The National Coronavirus Command Council has been meeting to discuss potentially tougher measures to curb South Africa's rising COVID-19 numbers. So let's bring into the conversation the convener of the Progressive Health Forum, Dr. Aslam Dasu, and the Chancellor of the University of the Free State, Professor Bonang Mohale. Good evening to both of you, and thank you for your time on News at Prime tonight. One of the things that is being said consistently is, what are the creative ways in which government can still have the benefit of restricted movement and yet not completely stifle the economy and lead to greater losses in terms of jobs and any income that people lost out on in the past year. Let me begin with you, Professor Mohale. What are some of the ideas that you think government can explore?
In the more than 420 days of national lockdown, there's always been about two considerations. The first is to ensure that we save lives. The second, we preserve livelihoods. It's not either or, but both end together at the same time. But we also know that a society that values more the loss of the economy than it does the loss of human life actually does not need a virus, because it is already sick. So all of us have to redouble our efforts, because we have always understood that vaccine rollout was always going to be a race, because the country that can achieve herd immunity first and therefore proclaim that we have defeated the virus, we will reap the pent-up global tourism demand. Where we are today, this week, we saw both London and Paris opening their transatlantic flights. We saw Spain, being the second most visited country in the world, opening their borders to 10 other countries. The town of Valencia, they're saying you can come to the beaches. At the same time, South Africa is talking about potentially tightening up the national lockdown rules. We have always been behind and lagging behind. At the moment, we compare ourselves with other African countries. 20 of those countries are ahead of us in terms of vaccine rollout. Only 11 are behind us. The president set us a national target for herd immunity of 67%. That's 40 million people, is the entire adult population. The run rate in January was supposed to have been 100,000 a day, every day. Where we are now, only now are we touching 650,000. The Minister of Health said by the end of March, we would have vaccinated 1.2 million frontline healthcare workers. But in total, I think now we should be talking about probably achieving 300,000 a day, because had we started in January, it would have taken us 400 days, 13.3 months. Now where we are, approaching the middle of the year, I think we need to up that run rate before we even talk about toughening up measures, because those people that have been vaccinated, we know that at least they get some sort of protection.
Dr. Dasu, if we're to go on this conversation around, well, increase the number of people you're vaccinating, and then we can talk about restrictions. We know that we're only set to receive a specified number of vaccines over a specified period of time. So there doesn't seem to be any catching up that we can do before we hit the peak of what could well be the third wave of COVID in this country.
Yes, good evening, Kathy, and good to be with you and Prof. Mohale. I must say that I agree with a lot of what Prof. Mohale has said. I think the vaccine rollout has been a bit of a saga in our country. We know that we are late in the day, having started, and we know that the start has been very slow. And this is a lot to do with the government's own response and some factors that have been outside of its control, like the recent cessation of distribution of the J&J vaccine. So I think if one looks at the risk matrix, and the government is purportedly looking at a risk-adjusted approach to this, the third wave, this imminent resurgence, would have been attenuated had we had the kind of vaccination rates that Prof. Mohale was talking about. This has been proved in other countries, so there's not much to argue about there. Our major initiative right now must be to accelerate the vaccination. Clearly, there's no question about it. However, it will not have an appreciable impact on both the scale and the duration of the third wave. What we might get is protecting some older folk who tend to get much sicker and get into hospitals. So hospitals may feel less of an impact, but as a wave and in terms of infections, I think that deal is done. Now, that means that we now have to be very diligent in our other measures around, attenuating this wave, our non-pharmaceutical interventions and so on. But it's important, and I think Prof. Mohale raised it, that we don't go with a blunt instrument into some lockdown and restrictive approach on the economy, because every point loss of the economy translates into decreased longevity and huge mortality that will make your numbers of deaths in COVID a picnic over time. So it's important to keep the economy moving even at this very difficult time where the resurgence has begun. And I think a targeted approach, particularly with gatherings, non-essential gatherings, is where we start. And there we should aim for prohibiting all non-essential gatherings, social gatherings, religious gatherings and the like, to less than 20 people. That way we will have an impact. We know that gatherings bigger than those are likely to be super spreaders.
Professor Mohale, let me wrap up with you. Perhaps your final thoughts on this issue?
So I think on paper we're looking good, with the government having procured 31.1 million doses of the J&J vaccine. The Pfizer one, again, another 20.1 million. So it will cover the 40 million population that we have. But having said that, I think we are already in the throes of the third wave, because there are three measurements. Is the total number of cases of infected people. Secondly, is of the people that have been tested, how many of those are coming up positive? And then lastly, the total number of hospitalizations. On all those three measures, in Gauteng and the Free State and in most of the country, those numbers are worryingly and concerningly going high. Lastly, I think the private sector has offered to really work hand in glove with government to say, let's use our facilities, distribution centers, our mines, our hospitals, to make sure that we reach herd immunity as quickly as we possibly can. Most countries, Israel, Australia, New Zealand, the US of A, the UK, have exceeded 40% immunizations levels, and we are still languishing behind. Lastly, I think we need to be very thoughtful about what is it that we are sending out as strategic conversations about this third wave in terms of the behavior of our own people. Kathy, there are some hospitals that don't have water as we speak. Bryanston suffered 2 water cuts during the course of today. How then to expect people to wash their hands with running water and soap in the midst where we'll probably be killing people with cross infections purely and simply because we have not paid particular attention to the infrastructure, because it seems like our focus is somewhere else.
All right, let's leave it there for tonight. Bonang Mohale, he is the University of the Free State's Vice Chancellor and, of course, Progressive Health Forum's Dr. Aslam Dasu. Let me thank you both for your time this evening.